Today is the 17th day in the month of August, the year 2023. And we are here live and direct, reporting from our studio, IKD 106.1 FM. This production is called The Issues, where we talk about our health. Every Thursday, this is how we do it. Of course, you know that your health is important, and that is why it is said that health is wealth. Every Thursday, in line with General Hospital Ikorodu, we talk about healthy conversations where you and I have the opportunity to learn and at the same time stay healthy. This is courtesy Ikorodu General Hospital. So I say welcome to the issues today on IKD 106.1 FM. This production will last up until 12 p.m. where we will talk extensively about our health. Today, of course, I have a guest in the studio in person of Dr. Nuruddin Kolawole. He happens to be a consultant from General Hospital Ikorodu, and we will take a deep look at our conversation to be titled Role of Ultrasound Scanning in Antenatal Care. The theme and the focus for today on the issue is Role of Ultrasound Scanning in Antenatal Care. We go on a very short breather. When I return, the issues begins proper. Good morning, Lagos. You're welcome back to the issues on IKD 106.1 FM. You can also join this production from anywhere all over the world via our website, www.ikd1061fm.ng. You can also make any your contributions, questions whatsoever by sending a text message or WhatsApp message to our studio line during the course of this conversation. That is 0904 082 1061 0904 082 1061. If you want to call in, you can call either of the studio lines 0904 081 1061 or 0904 082 1061. My name is Okpayemi Adebambo. I will be your host for today while we talk about the role of ultrasound scanning in antenatal care. Like I told you before that short break, I have a doctor, a renowned and of course a well-grounded doctor from General Hospital Ikorodu in person of Dr. Nuruddin Kolawole, who will do justice to the conversation. Doctor, good morning to you, sir.
Good morning.
It's good to have you in the studio.
It's my pleasure to be here.
Thank you very much for joining us, Dr. Nuruddin. So, Dr. Nuruddin, today we talk about the role of ultrasound scanning in antenatal care. This topic, of course, is very germane. It's important for people out there to understand and have a proper understanding when we talk about ultrasound scanning and, of course, when we talk about antenatal care. So, first off, Doctor, let's talk about ultrasound scanning. What exactly is ultrasound scanning? How best can you define ultrasound scanning? Let's start from there.
Well, good morning all. Ultrasound scanning is it's an investigative procedure which involves the use of machine to pick changes in the human body. Ultrasound waves beyond the audible limit. Human beings have a limit of sound that can be heard. So high frequency sounds are sent to the different parts of the body through a machine. Because of the difference in the direction, the speed at which it travels through the water solid organ in the body, so it gives some waves which is now transmitted through the machine, which is now interpreted as information. So when the message is sent, let's assume a woman is pregnant. The message is sent to the pregnant uterus, waves are sent, the images are picked on the machine called the ultrasound machine, and it's now relayed now in form of pictures, in form of dots that can now be interpreted. So for that reason, if a woman is pregnant, you can see the baby. If as early as 1.5 months before the woman even knows she's pregnant, that can be picked and in other forms. So that's simply ultrasound machine.
Thank you very much, Dr. Nuruddin. We will continue this conversation, giving a brighter understanding to our listeners out there. Now, if you're joining us, this conversation has to do with the ultrasound scanning in antenatal care. So for every pregnant woman out there, and of course to men, that is husbands, fathers out there who have wives that are pregnant, it's important that you learn from this conversation today. And for those of us that are, hoping to be in that line too as well. It's a conversation that we all should learn from as adults, especially as a married adult. So now you have defined ultrasound scan well enough, but then I want you to shed more light, give us that understanding. What is the relationship between ultrasound scan and pregnancy? Because when we talk about antenatal care, we know that is for pregnant women. So how do they relate? How do they tally ultrasound scan and pregnancy?
Antenatal care, let me just this is a form of care that is given to pregnant women. So what's the aim of pregnancy? As a husband, you are happy, my wife is pregnant, you are expecting a baby.
Exactly.
Same as the woman, expectation is high for the mother, the expectant father, even the relation. So for that reason, so the care is necessary, because during pregnancy, a number of issues can arise during which may lead to adverse outcome. Nobody wants to have a pregnant woman and now have a miscarriage or lose the baby. So for that reason, care that is given, during which education is given to the mother, health education, baby is taken care of, monitoring of the baby, to make sure that at the end of the day we have a healthy baby and even the healthy mother. Now, ultrasound, as I've said, is one of the diagnostic tools that is used. It is very important because, one, it is very cheap, relatively. It is non-invasive. Unlike before the advent of ultrasound, about like 50 years ago, not to pick abnormalities, because sometimes we have women giving birth to abnormal babies. So tests are done in which blood is taken from the mother. But with the use of the scan, you don't even need to carry out any puncturing use of needle into the mother. So also, the ultrasound, it's also can easily be learned in terms of the knowledge acquisition, in terms of the training. So, and it's also, especially in this developing country where the manpower is scarce, so we use of the machine, we can definitely pick a lot of factors. So it is a very important tool for us during pregnancy. We use it to assess a problem early in pregnancy. Let's assume a woman misses her period. We want to confirm pregnancy. So if there are issues, sometimes during pregnancy, early in pregnancy, a woman may start bleeding. Of course, one will be very careful. One will be worried that, why am I bleeding? The pregnancy is still there or not? So with the use of scan, it's possible for the pregnancy to continue. So we use that scan to monitor the growth of the viability of the pregnancy. Assure that, okay, this pregnancy is still there. That's why that she bled. You say, okay, madam, come bed rest, after which pregnancy continues. Sometimes the pregnancy is also, the scan is also important during antenatal, because it also helps us. Multiple pregnancy is very common in this environment.
Yes.
So some people, as early as even like 1.5 months, 2 months, you can pick twin pregnancy or even triplets, as it were, so that you can prepare accordingly for this, for the subsequent pregnancy. Also, some abnormalities can be picked during antenatal, during which can be treated, and the pregnancy continues. Unfortunately, some of them may not. Sometimes a woman may be pregnant, may be having pain. Scan will help us to know whether the pregnancy is a normal or not. Pregnancy may be ectopic, what we call ectopic, in which the pregnancy may be implanted in a wrong site, maybe outside the uterus, which is supposed to be the normal location. Later in pregnancy too, we can also pick abnormality, because we know now people, because of infertility and technology, people go through assisted conception, IVF, in which you have triplet gestation. It also helps in monitor early diagnosis, so I know plan the management of the pregnancy subsequently. And then later in pregnancy, sometimes a woman may have abnormal placenta location, what we call placenta previa, in which normal delivery for that person may be difficult. Later in pregnancy too, you assess the growth of the baby. Some babies don't grow as it's supposed to. So they are slower in growth, while some of them grow beyond. So that will also guide the obstetrician or the managing doctor to manage the baby. So at the end of the day, we have a healthy baby and the mother. And sometimes if there are problems that arise later in pregnancy, let's assume a woman develops high blood pressure, what we call preeclampsia, which is a common condition in this environment that actually can lead to the death of the woman or the baby. So scan can help us unravel it early, and we can institute the management and probably deliver the woman earlier so that the baby can survive, and at the end of the day, the mother too will be saved.
Thank you, Dr. Nuruddin. Very well said, well explicitly said. The essence of this conversation is to create a proper awareness in the minds of our women, especially the pregnant women, and of course our fathers that are out there. So we will still talk extensively about the importance of ultrasound scanning during antenatal. No doubt it's something that is very important. But then the next question will be that some persons will just tell you that while we were growing up, as mothers, we did not even do anything called ultra scan, and then my baby is bouncing. You can see him, he's a man today and all that. Before we even get there, to clear the air, when we talk about ultrasound scan, does this have to do with just pregnant women antenatal alone, or it is another form of scanning that you could also do for other forms of illness? Just to be clear, is it for just pregnant women alone?
Ultrasound is not restricted to pregnant women alone. In fact, it cuts across all the specialties of medicine. It's used in obstetrics, which is antenatal management.
Yes.
Then in gynecology too, non-pregnant woman, maybe a woman wants to get pregnant, is one of the investigation tool we use to investigate. May pick ovarian masses, may pick fibroid, and the like. Then also in urology, they use a lot of scan, which you can use it to detect cancers, can use to detect masses.
Wow.
Also in cardiology is also very important. That's the field of medicine that is related to the heart and the problem. So use of cardiology, ultrasound can also involve addition with Doppler. You can use to Doppler ultrasound, which can pick heart problems, people have hypertension, those have valvular problems, in which there are different chambers of the heart. There are 4 chambers. There are connections between them, what we call the valves. So if there are issues with them, the scan can be used to pick it early enough. And that's why you see, even now, as early as possible, people pick problems and they can now face it, institute management early as against if that is not picked. Even in neurology too, and detection, we use ultrasound also help in early diagnosis of cancers. ENT is very important too. So almost all the
ultrasound is multifunctional. It's not just a pregnant woman thing alone. Yes, I just needed to be clear on that side, and of course to also ensure that our listeners are very clear, because when we hear ultrasound, we have the mindset that it's a scan that is done for pregnant women. So now let's talk about when we say ultrasound, our fathers weren't doing this thing, and they will still tell you that our children came out well. So you as a doctor, what's so important about ultrasound scan? Why ultrasound scan?
Yes, that the truth has to be said. Before the advent of technology, there was life, and people were living using their local medication herbs and so. But as technology grows, you now have invention. Just like maybe about 100 years ago, or even as far back as 60 years ago, there was no radio.
True.
There are radio, but it's in developed countries.
Very
but now, use of cell phones too. Some countries have it now. It's all over. So as technology goes, before then, I think maybe because of the lifestyle with technology, with advancements, we have other factors now affecting humanity. So we now have more problems, and usually scientists now develop ways of picking some of or identify this problem and solving them. So maybe before then, the primitive age, there weren't many problems. Of course, then there was no aircraft, there was no use of additives, no use of bleaching creams,
telecommunication and all was non-existent.
People take fresh food, go to the farm, harvest fresh fruits. So now we even have instances when people treat fruits prematurely, or some plantain, they add some carbide and things. So all these things have effects on the body. But then all these problems were not there. So probably that was the reason why they were living their life before then. It doesn't mean that there were no mortalities. Like before the advent of science, we have sickness, they call Abiku and things like that. But the advent of science, we realized that they believe that it's God, maybe a child that died, the one that called back, the one that is living. So with technology, yes, we have technology now and advancement. Then, maybe because it was primitive, problems were fewer.
Yeah.
Just like now, we have urbanization, more problems. When we are in the rural setting, population was less, so there were less problems. So I think that was how I can answer that problem.
I can't agree less with you. Yes. So bigger problems, and we need more technology to advancement to help build that one. I would like you to tell our pregnant women generally listening, why it is so important, to undergo this ultrasound scanning during antenatal. But I want to ask now that when we say ultrasound scanning, at what stage at what point does a pregnant woman, need to undergo this ultrasound scanning? We know that there are some scans that they also go through. Aside just this one, they will tell you it's when you're 3 months or when you've gotten to a particular month. There are still some that I think, if I'm not mistaken, they will tell you a month before delivery, you have to do this, do that. Ultrasound, when should a woman undergo this scan?
So ultrasound, as I've said earlier, is a diagnostic tool. Now, and during pregnancy, there are issues that can arise which can negatively affect the growth of the progression of the pregnancy, especially to the baby. So first, when a woman is pregnant, as early as she missed her period, we advise a pregnancy test, because sometimes a woman may miss her period and she's not pregnant.
Wow. So
when you do a pregnancy test, okay, if the woman is pregnant, we know, say, okay, maybe the woman is pregnant, but that pregnancy, all pregnancy has to be confirmed. So missing period, as I've said, is not a pregnancy. And when the woman is pregnant positive, we need to know the location. Is it a normal pregnancy or is it an abnormal pregnancy? So a normal pregnancy, when you have a scan as early as maybe 2 months, there's a normal pregnancy in the uterus, one baby or twins. Or if it's an abnormal pregnancy, that's an ectopic pregnancy. In that case, sometimes before even ruptures, because most time it's when it's rupture that people now know that, oh, this woman has a ruptured ectopic. So scan can help pick early. When you do an early scan, it will help us pick if it's a wrong location, which is called ectopic pregnancy. In that case, treatment can be instituted. Patient does not need to undergo surgery. You can give conservative management by way of drugs. So that's for the early. So later, as now, or if a woman is pregnant, assumed to be pregnant, she now not feeling well, now bleeds, or she's having abdominal pain. What should be worried that
what's going on?
So by having a scan, even after bleeding, when the bleeding resolves, we know that maybe that woman had miscarriage, what we call threatened miscarriage. So if the bleeding resolves, pregnancy can continue. So the scan can assure us that there's nothing wrong with this pregnancy.
She's fit to go.
Yes, but however, if it's an abnormal one, or maybe the baby dies early, what we call blighted ovum, or missed abortion, in that case, we know that the woman has lost the pregnancy, so we should know in time. So later on, as maybe in the second trimester, if we're early, we can use it to detect problems. Maybe a woman that didn't get pregnant in time, having a first baby at the age of 35 and above, we can actually use it to detect some abnormality, because they are prone to having abnormal babies. So we can do an early scan we call assessing nurture translucency. It's a special scan in which they look at the thickness of the back of the baby as early as 9 weeks or 11 weeks. So that can help us know if that's an abnormal baby. Or some people, in case of Down syndrome, you see nobody want to have an abnormal baby. So as early as 2 months, 11 weeks, one can pick some of this problem. Then later, I told you, advent of assisted conception. We have a lot of IVF pregnancy going on now. So we do what we call anomaly scan. So around between 18 and 22 weeks, it is possible to do a scan and assess the baby from head to toe. So if there's any abnormality, maybe there's heart defects or there are skeletal problems or soft tissue problems, it can be picked as early as possible. So in that case, we gotta guide the woman. As another case, way of preventing problem and monitoring, assessing. So some people, when you counsel them, you say, oh, you know that it's an abnormal baby, they say, I don't want this pregnancy, or you cannot support. Sometimes you even need to refer maybe to a teaching hospital or a hospital where they can take care of where they have pediatric surgeon, where they can take care of. Sometimes they can even operate the baby right in there. So those are things that we have to important of scans. Why some women, which I think is a social reason, when they are pregnant, as soon as I want to know, is it a boy or a girl?
Exactly.
God, they want to start shopping as early as possible.
Yes.
So that will also help. So when you know it's also multiple gestation, you want to know the type of twin gestation it is. Is it monochorionic? Is the two baby inside the same sac or in different sacs? Because if it's the same sac, there are risk of problems. As I've said, antenatal care is meant to prevent problems and to treat problems, so that when we know, we can also guide in counseling the patient. Oh, this is the problem. Okay, we are doing well. Assessing the growth of the baby, we are doing well. So basically, scan is done early in pregnancy to confirm viability. Also, assess there are problems. In second trimester, we can do the anomaly scan, which will help us counsel the woman appropriately. Even some people that are mistakenly married, maybe ASAS, early in pregnancy, you can do a scan, special scans, in which you can assess and check the genotype of the baby as early as 2 months. So in that case, can also help us guide in the counseling of the couple to decide on what they want. Then later in pregnancy, it can help determine the location of the placenta, which can either need to probably deliver the woman normally or delivering by cesarean delivery. Another very important way is therapy. Sometimes there are some conditions in which a baby develop problem while during pregnancy. Like a condition is when we have ratios anomaly, in which the woman is negative. Maybe she's negative, maybe B negative or B positive, and has been pregnant before. Ideally, she's supposed to be protected by way of having an injection we call Rogam. So in that case, most women, maybe they are pregnant or they had abortion, they forget about it. When they are not pregnant, they may develop what you call antibodies, which can actually affect subsequent pregnancies. So in that case, when we know, with the use of scan, it can be picked. If the baby, the danger with this condition is that the mother's red blood cell can damage the baby's red blood cell, and baby can become anemic while even in the mother's womb. But with technology, it's possible to even transfuse that baby as early as 4 months, 5 months, 6 months, while still in the mother's womb. So all this is aided by the use of the ultrasound.
So if I get you correctly with what you said, there are no particular times which a woman can undergo this ultrasound scan. It's not as if it has to be 2 months. When the baby is 2 months in the belly, it has to be 4 months. There are no specific times that a woman can undergo.
There are no specific times. It has to be guided by the physician, maybe the health practitioner. But often, on the average, a pregnant woman is supposed to have about 3 scans.
Oh, okay. So this ultrasound scan is not just a one-time thing.
It is not a one-time thing.
Oh, wow.
It also, and that's why it's good. A woman is supposed to register for antenatal. Even if it's a low-risk pregnancy, can book with as early as maybe primary health care, not necessarily going to teacher hospital. So primary health care or private hospitals, general hospital, or even teacher hospital, as it were. Ideally, you are supposed to manage complicated pregnancy in teacher hospitals. If it's a straightforward pregnancy, first scan will be early in pregnancy to confirm the pregnancy, how many babies, and is the pregnancy viable. So second scan is usually done during mid trimester, maybe about 4, 5, 6 months thereabout. Then the last one is done just before delivery, about 36 weeks on the average. But sometimes some patient mothers decide that, okay, I just want to see how my baby is not kicking well, let me go and do a scan. So we can do as many times, but generally for normal pregnancies we do about 2 or 3 scans. For those that have twin gestation, we are suspecting problems. We sometimes request for more scans. Or if a woman has high blood pressure or has diabetes, or maybe she has ruptured her water before the time, what we call PROM, we can sometimes do this scan more frequently. Generally, pregnant women do about 2 to 3 scans during pregnancy.
Okay, so thank you for that one. Like I said earlier, you can join this conversation by sending in a text message or WhatsApp messages if you have, in line with our conversation, role of ultrasound scanning in antenatal care. The role of ultrasound scanning in antenatal care. You've been hearing the voice of Dr. Nuruddin Kolawole, a vast, renounced medical practitioner from General Hospital Ikorodu, talking about this. You can also call in when the time comes on our studio lines 0904-081-1061 or 0904-082-1061. Dr. Nuruddin, I want to thank you for your time. And still on this conversation now, I want us to talk about the types of ultrasound scanning, if at all there are types or there are forms of it, because one thing I know about scan is that there are different types of scan. So if ultrasound is another form of scan that can be done for pregnant women during antenatal, a form of care, are there types? And you've said it yourself that it can be done at least 3 times, not just one time. It can be done 3 times or even more than that. So please tell us, are there types of ultrasound scan, or is just a one ultrasound scan?
Now, ultrasound scan is one, but there are different forms. Based on the part of the body that you want to scan, and based on the probe that you want to use. Now, so during pregnancy, we call the scan that is done during pregnancy obstetric scan, which is a pregnancy done during scan done during pregnancy. We call it obstetric scan, in which we assess the pregnant uterus and the baby. There are parameters we check. That's what we call obstetric scan. Now, but everything, just like saying Ikorodu, you understand? Ikorodu is a town, but we have different streets, we have different regions. Same as the scan. So depending on the part of the body you want to scan. So you can also do a pelvic scan. Pelvic scan is done on a non-pregnant woman, a woman that is not pregnant.
That is not pregnant.
So we assess the uterus, the ovaries, the cervix. Then you can also do, depending on the part, sometimes you can do a scan through the private parts. What we call it vaginal scan. We call it transvaginal scan. We want to assess the the endometrium, inner part of the uterus, or they want to assess the ovary. Then you can also do cardiac scan, which is done on the heart. So you can do renal scan to assess the kidneys, the bladder, as it were. So depending on the region that you want to assess. As I said, it is a diagnostic tool, like a test that is done. So depending on what you now want to assess, even we do scan on the neck, we do scan on the eyes, on the breast, even the testes. So these are different scans that we can do. But it's the same principle. It's the same machine, scanning machine. Okay. It's just the probe, what we use, depending on the part of the body. The probe is what differentiates the type of scan.
Okay, thank you very much for that one. Now, I want to ask you, looking at Ikorodu now, where you are actually practicing your field. Aside the fact that you're here on radio talking about ultrasound scanning, with the number of patients you've attended to as a gynecologist, are people aware? Do people know this thing called ultrasound? Because is there an exposure for it? What's the turnout like? Let me put it that way for your patients when it has to do with ultrasound scan. Are people coming willingly to General Hospital to say, I want to undergo ultrasound scan? Or you people are the one always telling them, do you know you can do this?
Now, I think both applies. I think people are aware now. I'm sure people have friends who are medical practitioners. We have relations in diaspora. Anything happens, have you done this scan? Have you seen your doctor? So our patients are relatively aware. Even for patients that pregnant women that don't even come to hospital, that go to traditional, some people still see nurses and even go through traditional care. They believe that you have to use our own traditional use of local herbs. Even they tell them to go and do scan, what we call the traditional birth attendants. So people are aware now. In terms of the scan, sometimes patients will have done the scan, present. When they do scan, they say, okay, you have a fibroid or you are pregnant. This pregnancy is twins. We can't manage you here. You have to go to the hospital. Why sometimes some patients come, doctor, I want to get pregnant, or doctor, I'm pregnant, I'm having pain. So they should go to the hospital. So when they come to the hospital, we now request for the ultrasound scan accordingly. So either way, some patients come with a scan to see us, while some, when they come, we request for the scan that is required to manage the condition. Okay, thank you very much. Let's just quickly, before we go ahead, let's quickly take one of these messages coming from WhatsApp. This is Mommy Triple F from Igbelara. She's saying, well done to our guest. My question is, myself here is pregnant with 31 weeks. Done 3 scan earlier, said the baby, okay, let me try to rephrase, it was not well rephrased, but she's saying, my question is, myself here, I'm pregnant with 31 weeks, and she has done 3 scans early, and they said the baby was fine, but the baby usually move little by little sometimes, and sometimes the baby kicks hard. Hope no problem. Planning for my next scan in my next appointment. Can scan be done within this week or anytime? Thanks. So I think rephrasing that, she wants to know, because sometimes she said the baby kicks little by little and sometimes the baby kicks very hard. So let's attend to Mommy Triple F from Igbelara. Okay, thanks for the question. The fetal movements, babies are like individuals. I'm sure everybody have different pattern. So babies movement, the pattern of movement of baby differs. So the mother will have known how some babies are very active in the morning, while some will be asleep in the afternoon. So the mother will have, over time, she will have understood the way, the character of the baby.
Exactly.
So when they notice, that's why we tell them, sometimes we give them what we call the fetal kick chart or assess. So far the baby kicks about at least 10 times a day, or at least about 4 times in 2 hours, as it were, you know that baby is okay. Understand? So the movement of the baby also depends. If the mother is hungry or she's a very busy person, she may think, oh, baby is not moving. From time to time, by the time she assess, the baby will kick. So I don't think she should worry so much that sometimes baby kicks well or baby does not kick well. So far she feels,
and sometimes it kicks very hard.
So babies too, sometimes depending on the activity of the mother, if she's very active too, baby may be active, baby may be sleeping sometimes. So baby too have their own pattern. But the important is that the mother should understand the pattern of the baby, and baby should be baby should be moving from time to time. Not that baby will sleep all through the day. That's not good.
Okay, just one more. We'll take this last one from WhatsApp, and then maybe others would have to call in directly. This is coming from. Let me turn out this one. Okay, I think the name is not included in this, but this person wants to ask that how valid. I'm trying to rephrase. This was actually typed in Yoruba, so it's a bit difficult for me. He said, how valid is scan? Sometimes they scan you that your baby is a boy and you give birth to a girl. I think this person is asking, Arewa, okay, the name is down below. Arewa wants to know, why do we have scans? And then the next thing they will just tell you is that your baby is a boy and then you give birth to a girl.
No, straightforward. Issue of sex has to do with, one, the timing of the test when the scan was done. The best time to assess fetal gender or the sex of the baby is between about 24 to about 32 weeks.
Okay.
But as early as 16 weeks, when the wife is pregnant, 4 months pregnant, you'll be able to see it. Now, it also comes with experience, because sometimes depending on how the baby is positioned during the scan, if baby fold itself, you may not be able to see the real. Yes. So, but ideally, as a sonologist, when you run a scan, you are not sure. It's better to err on the side of caution that honestly I'm not sure than to guess. Because by the time you guess, if it's a female, and probably the woman has been looking for a female, and now turn out to be a male, that's like 100% failure. So
especially when they bought a lot of items for the baby.
So oftentimes it depends on the gestation, on the time the scan was done. When the best as I've said is between 4 months and about 8 months. Also depends on the position of the baby, the quantity of the liquor. So, as I've said, if it is not seen, sometimes you do the scan and you will be able to see the gender. Maybe baby is folded, the legs are folded across the tummy. You may not be able to see, but it's valid. For those that are experienced in doing it, it can be as much as 100%.
But so, is that to say, doctor, that we cannot 100% say that scans for gender will be true? We cannot guarantee 100%.
Yeah, we cannot guarantee, but as I've said, it comes with experience. Sometimes we not even look for it, and you see it easily. Why sometimes baby may just, as if the baby knows that you want to check the baby. So in that case, tell the woman, honestly, I cannot see. But some women, they are so worried that they must know. I mean, I'm carrying a boy, I'm carrying a girl, and things like that. So that's just.
Before we go to the phone lines, I see the calls are coming in already. I am tempted to take one more message from WhatsApp here. This person is saying, well done to our guest, Alaja Kufa Yakun. Please pardon me. She said Alaja Kufa Yakun from Upper Salami. How early should the baby be delivered after the break of water? I don't know if you understand this because I'm not getting. Okay, you understand it. Yes, please go ahead, sir.
Normally, when a woman is pregnant, the pregnancy is the tummy, the neck of the womb, what we call the cervix, is closed. And even when people have sex, nothing will happen. Not that a woman is pregnant for the second time, you can't have. So by the time the system is shut down. So, and baby, the liquor, the water that surrounds the baby, is one of the that protects the baby too. So whenever it breaks, it's a disaster. We don't want. It's not a very good event that we want to happen in pregnancy. Now, if it happens too early, the pregnancy is as good as lost. But if it's after about 28 weeks of gestation, where we feel the baby is viable, we now try to see as a doctor, see how far we can push the baby. Because the best time to deliver a baby is about 40 weeks, what you call the EDD. So if it's not possible, we can now deliver between 37 and 38 weeks. So if that's still not possible, by 34th week, in which we are sure the lungs are mature, because one of the main problems of babies that are delivered early is the lung function. If baby cannot breathe very well, that baby may not survive. So as soon as the water breaks, so it depends on the age of the pregnancy. If it's after 28 weeks, we want to push it as far as possible. Give drugs that will help the baby to breathe well and to survive. Now, so it now depends. Maybe lucky to gain about, on the average, maybe gain up to 2 weeks. Because by the time the water is ruptured, the baby is no longer protected. And we know infection is everywhere and pass through the private parts into the baby. We don't want that to happen. That's why that we give antibiotics. So the timing of delivery depends on the gestational age. If it's after 34 weeks, we can deliver the baby as early as possible because we don't want infection. But if it's between 28 weeks and 34 weeks, The challenge is now when to deliver the baby. So what we do is we give drugs that will help the lungs to mature, what we call steroids. Then sometimes we also give surfactant, which will help the maturation of the lungs, because that's the main problem. The baby cannot breathe very well, that baby may not survive. So if we're able to do that, we now deliver. So the timing, as I've said, depends on the gestational age. If it's before 28 weeks, that may not even be. But if it's developed country, I even have a cousin that had the baby at 20 weeks. The baby was on admission for about 3 months, and the baby is well now. You even know. So in some countries, UK, US, because of the level of technology,
yes,
baby can survive. In this environment, after 28 weeks, we try to keep the pregnancy as far as possible. Administer drugs that will help the baby mature. If baby mature, we now deliver based on the competency of the neonatal intensive care in the hospital.
Thank you very much. Let's switch over to the phone lines and see if we can take in few calls, and then we go ahead with the issues today, where we talk about role of ultrasound scanning in antenatal care. It is very germane. It is very, very important. And doing justice, you already know, is my doctor, a renounced doctor, a consultant, obstetrician, and gynecologist from General Hospital, in person of Dr. Onolapo Nuruddin. Doing justice. Thank you so very much, sir, for being a part of this one. 0904-081-1061 is the studio line. 0904-081-1061 or 0904-082-1061. 0904-082-1061. Dr. Onolapo Nuruddin, the next question I want to ask you now, I am tempted to ask this too. When we say that ultrasound scanning, you know, what is the next thing for a woman to do? Assuming right now a woman is out there, that I know a lot of women are out there listening, and they determine, or they are deciding now that I also want to start this ultrasound scanning. What should be the first thing? What should they do? How should they go by it? What are the procedures?
Ultrasound during pregnancy is usually prescribed. You know, it's the doctor that will tell the woman to go and have a scan.
Okay, so it's not a thing they can just decide for themselves.
Just say, me, I'm going to do scan. I remember a story some years back. We had that the man he took before he's from the eastern part of the country. Sorry to say that. So the one was now pregnant. After every clinic, the husband will ask, "You didn't have a scan?" So he said, "The doctor didn't tell me to do scan." Now say, in annoyance, the man went to buy a scanning machine for the wife.
Wonderful.
So it was so funny. So it's not that ideally it's supposed to be the doctor supposed to make requisition for this scan based on, because when the patient come for care, for antenatal care, you ask questions, you give you advise the exercise. Antenatal is not just come and so assess. Then based on the age of the pregnancy, we examine the woman. So if everything is okay, as I've said earlier, I said we need about 3 basic scans. As soon as the woman is pregnant, we are supposed to have a scan to confirm the age of the pregnancy, because sometimes mothers don't know the last period. And sometimes maybe they miss their period, they were bleeding in between, so it may be difficult to date the pregnancy. So it's supposed to be requested by the doctor. But if sometimes the woman is so weak, sometimes the doctor, my baby is not kicking well. When they come, we check the heartbeat of the baby. Baby is fine, it's growing well. But in order to, I say they are fair. Sometimes you go and do a scan. By the time they do the scan, baby is fine. They now rest assured. But some mother will say, because they want to know the sex, like the woman that requested for a gender want to know the sex of the baby, and the sonologist said, I can't see the baby is not lying well. I can't see I cannot assess the sex of the baby. Now the woman may go to another place to go and check. Okay, let me go and, because
maybe that doctor does not know what he's doing.
That's what she wanted until she's satisfied. So basically, the doctor is the one that requests for.
So it's not a thing a mother, a pregnant woman should just decide to do. Really. And even to our fathers out there listening, please don't frustrate them and say by force, "Tipati kuku, Lord, she scan is here."
Yes, as I've said earlier, scan is safe, is cheap, and non-invasive. But studies are now being conducted to find out the potential danger, because as I've said, high frequency sounds are sent to the baby.
Let's see if this call will go through. Sorry. Hello.
Hello.
Yes. Good morning to you, sir.
Good morning, sir.
Your name and where you're calling us from?
My name is Mr. Aladula Stampa.
Okay, talk to us.
Please, I want to ask, just be patient with me.
Okay.
This ultrasound, is this for only men or women? Only women or men? The reason why I ask this.
Hello. Hello, Mr. Olari Bigbe.
Some men, if you look at stomach, a local woman who are belly. I do test for those also. That's what I want to know.
Thank you very much, Mr. Olaridigbe. Your question will be attended to by the doctor. Thank you. I believe you got his question. Yes.
He was asking if it's meant for women or is it for both sexes. Or
yes.
No, I said it earlier that scan can be for everyone. Now, he was talking about the fact that some men have
big belly, pot bellies.
Pot bellies.
Yes.
Yes, it can be done, but oftentimes, I won't say because you have pot belly, you go and do scan. But it can be done if it's due to fluid, but most times it's because of fat. As men, those that take alcohol.
I was going to ask what causes pot belly.
So sometimes it's the habits. Why habits? People that don't exercise or people that take too much carbohydrates. People grow if they don't exercise. So they tend to. It's against women. When women grow, they tend to have more either tummy or the thigh or their because that's when they add fat.
Yes.
So I'm not saying that those that do scans too. We don't advise too many scans. Except if indicated, because people are now looking at the fact that is it really, we say it's safe. The sound they are sending to the baby, they are monitoring babies that have number of scans, and as they grow, they are monitoring them to see their potential problem that can follow too many scans. So what I've said, just for our mothers, but when people have the money to the extent that they can be doing scan every clinic, so one day to be having scan every clinic, so there's really no reason why you should be doing that, because doctor will examine you, ask questions, measure the size of the pregnancy, and then request for investigation accordingly. Okay,
thank you. Maybe this will be the last question before I let you go. Again, I want to say thank you very much, Dr. Onolapo Nuruddin, for your time. Now, when we say ultrasound scanning, I know that Ikorodu General Hospital does this in line with the antenatal care, which is very good. But is it same with other hospitals? Because with the way you've said it and your emphasis on the importance of ultrasound scanning, it's something that every woman should undergo while pregnant. Is it same with other hospitals? Because I'm not sure.
Yes, ultrasound is done almost every time it's available. I remember when
it's something that is made compulsory all over.
Yes, because there's a standard. Another care, there's a protocol. There's a guideline for managing a woman in pregnancy. So the standard is that you should have at least one scan early in pregnancy, mid-trimester, and then late in pregnancy. Then also if there are other special indications, that will be done. That's the standard. Just like WHO gave guidelines, then different countries now domesticate. Understand? So there's a standard. So, and that's why in a standard healthcare facility, ranging from primary healthcare, secondary healthcare, even to tertiary. So this investigation is done. But when we were students those days, like about 3 decades ago, then to have a scan done, so we have, like, maybe we have only high school in the north, we have only 2 or 3 scans. Then here, almost every hospital, even some traditional people have scanning machines.
So, they've upgraded.
So yes, so almost everybody does. So there's a standard, and it's almost everywhere that is done.
So it's not like as if people do not have easy access to ultrasound. There is an easy access to that.
It's not too expensive too.
I was going to ask you now that when you say not too expensive, sir, doctor, let's be sure. Something that is not too expensive for an ordinary man might be pretty expensive. How affordable is ultrasound scan?
Well, scan is relatively affordable. I think on the average it goes for about between 2,000 and 5,000 naira.
Oh, that's affordable.
Though there are special ones, as I've said, the anomaly scan is a specialized test that may go as high as maybe between 10 and 15,000. Then we now have, with this technology, we have colored ultrasound. We have 3D, we have 4D, in which where you can during the scanning you can be seeing the baby live, colored, as if you are watching high definition television. Wow. So we call it 3D and 4D, which helps in assessing baby that have abnormalities. You see some baby have abnormal, maybe the head is too small, they have small brain, they have big head. That can be seen as if you are watching clearly. So those are 3 and 4D. Of course, those may go for maybe hundreds of thousands for the scan.
But for the normal one, which is around 2,000 naira, and maximum maybe 3 times, it's still very fair. So thank you very much, doctor. But before you leave, I want you to again, in just a few minutes, state clearly the importance, for the benefit of our mothers out there, the importance of this ultrasound scanning. I have heard before where a woman will just tell you that my mother did not do it for me and she gave birth to me, so I don't need to go through that rigorous procedure. So please, again, tell us the importance of ultrasound scan.
Ultrasound scan is a very important, relatively cheap, non-invasive diagnostic tool. It's very important to us, especially in obstetrics, because we want to minimize any damage or any external factor to the baby. Because if anything now happens, and that's why we don't do X-ray during pregnancy, because the radiation can cause problem for the baby. Can even develop abnormalities. So for that reason, because of the safety, so scan is used during pregnancy. Early in pregnancy is very important, as I've said. So women don't keep their dates. In fact, so women even get pregnant after winning the previous baby. Let's say they have a baby they were breastfeeding. The period will not start before they get pregnant again. So when they do the scan, it will help the doctor date the pregnancy. And by dating the pregnancy, you can now know the exact gestational age of the pregnancy. Because sometimes later in pregnancy, the woman may develop problems. If you have hypertension in pregnancy, you may have anemia in pregnancy, to which pregnancy may not be able, or have diabetes in pregnancy. And the gestational age is key at delivering the baby. So if you know early, it will not be issue of, okay, this pregnancy has gone beyond the
so
age
it's
of
like
the
earlier the better.
The earlier the better. So secondly, also help in the growth of the baby. You are used to assess the growth of the baby. Early pregnancy, for someone that have maybe miscarriage, it's very important to guarantee to know when the pregnancy is viable or not. If it's viable, we assure the woman, and that's very important. Can also be used to early diagnosis of extrauterine pregnancy, which is ectopic. Most women present when they are gasping, they lose much blood, they are weak. So by doing early scan after a woman misses her period, it will help us diagnose ectopic pregnancy early, and you cannot use drugs instead of going through surgery. Then later in pregnancy too, you can also assess, because of education and economic factors, women marry late. So if a woman is having her first pregnancy after the age of 85, you can do an anomaly scan. We hope not. If there's an anomaly or baby has serious problems, the woman can be assured and counseled accordingly. Not the one that is hoping that my baby is coming as sure for the baby, hoping to have a bouncing baby boy, only to have a baby without hand or with a very small head or no eyes and things like that. So these are things that will also help us. Then later in pregnancy, if you have twin gestation, because when you examine, you can only examine the first one better. The second one is right in there. For the obstetrician, it's difficult for you to assess the baby. So scan is important for us to be able to assess the health of that second pregnancy. Then also late in pregnancy, sometimes when they examine, the baby is coming with the buttocks, which is not what we want, or coming with the hand. Scan can also help us. Or if the placenta is leading the baby, it will be dangerous for the woman to deliver herself. So scan will also help us. Because we use to assess the weight of the baby. Some baby are very big, or they have diabetes or some other dangerous conditions, medical condition in pregnancy. So by using the scan, we can tell us, see whether the woman can deliver herself or not. Then it can also be used to prevent problems. Sometimes, as early as possible, when you do a scan, special scans, like Doppler ultrasound, you can use it to prognosticate a woman that may likely have preeclampsia. Let's assume she has had preeclampsia before, because preeclampsia is one of the commonest causes of maternal deaths in this environment. So we always want to look for it. Or maybe a woman has eclampsia, she convulsed during pregnancy, so it can happen again. So we can do scan early, maybe as early as around 20 to 24 weeks. Check the placenta very well, go do a Doppler, we tell us, this woman is likely to, so we can now give drugs to prevent the problem and see how far we can push the pregnancy. So these are things, and if a woman is not comfortable, maybe baby is not kicking well, because sometimes baby gives sign, sometimes baby die inside the womb. We pray not. It's a disaster. So when the woman notices that this baby is not kicking well, oftentimes we advise go and do a scan, and sometimes it gives us a sign that this baby may likely die soon. So in that case, it can also help us to. We can also use it to assess the baby by way of some special investigation, what we call biophysical profile. We check the breathing of the baby, the movement, the water. So with that, it can also help us to assess and determine the right time to deliver the pregnancy. These are some of the very important.
Thank you so very much, Doctor. It's good to know that you are a man and you know your onion well. Please, your parting words to fathers out there that have their wives pregnant already, because sometimes we see that these women are being controlled by their husbands. They don't go and do anything. They don't come and tell you, just what would your advice be as a man that you are to fathers out there?
As a man, honestly, I think our fathers to support our pregnant woman. Pregnancy is really a potentially emotional and can be very stressful. So the woman needs all the support. and let's ensure that we register for the antenatal care as early as possible. Then you also keep to the appointments. Because oftentimes we can pick problems. Most of the problems that happen in this environment are preventable. So by doing that, the father should make sure that if you cannot follow the woman to the clinic, you can always ask her what happened, what did the doctor say,
how did it go. So
let's make sure, let's pick interest, because it's not just for the woman alone. The baby is on behalf of the father and the mother.
Exactly.
So let's give them all the support that is needed, and then register, make sure they keep the appointments. Whenever the doctor say come or they are giving admission, they should make sure they honor the because oftentimes doctor will have told them the reason why. We don't just admit for any reason. So let all the support that is needed, let's give, and let's make sure we register for antenatal. Up till now, quite a number of our patients will not register. They will now come when it's too late. They will now come to the hospital and put the already strained,
because they know it's almost time to delivery.
So they will now come, and some will have come, maybe baby has died or has a serious complication.
Thank you so very much for joining us today on the issues. This is how far we can have it on the issues today from the department, gynecologist department, in person of our consultant, Dr. Onolapo Nuruddin. He happens to be a consultant obstetrician and gynecologist from General Hospital Ikorodu. We want to say thank you so very much. It was indeed educative. I enjoyed it, and I look forward to being in that position where I can advise somebody now confidently on ultrasound scanning. You know, I've learned enough already. Thank you so very much, Dr. Onolapo Nuruddin.
My pleasure.
Regards to every staff and management of General Hospital Ikorodu. My name is Opayemi Adeban, but the issues continues tomorrow with Gift Ogbona. Do have a healthy and a beautiful day ahead of you. It's a bye for now.